My name is Dr. Tujan Rahal, and I'm the CEO of Engineering World Health.
My name is Cozy. I'm the Operations Coordinator at Engineering World Health. I oversee our university chapter program and all of our engineering education initiatives.
About 20 years ago, two professors in Tennessee, actually, so Dr. Biomedical and Dr. Mohammed Kiani, noticed there was a need in countries that are underserved and have low resources where it comes to hospitals. And so initially they wanted to donate hospital equipment. And then they quickly realized that lots of donated hospital equipment was just sitting there in what we call graveyards. So they were just piled up in storage rooms, not used, or they're missing parts, or they're missing manuals. So quickly shifted purpose into repairing hospital equipment and providing more robust manuals and instructions on how to use them, how to replenish supplies for the equipment. And that's how EWH was kind of born and continued to serve.
Something that we talk about a lot is just how unique the kids program that we have is. It's a way for students to really get to see the how science and engineering can really be used in real life, because sometimes I feel like when you're in a science class you're like, okay, I'm learning about this, but I'm not necessarily seeing the real life application. And I think that I get excited when I see the kids kind of discovering that and getting excited by, oh wow, I see that a heart rate monitor, I can build one of those and I can see that in action.
We want to make sure that everyone has access to STEM at a young age, because that's really when they make up their mind if they're going to pursue STEM or not. And as many people know, the research shows that the innovation, that's not going to come from having everyone look the same and be the same background and upbringing for science and technology and engineering. And so when we can foster that, it's so powerful. And the beauty of how we came up with our kids program is, we had these kids for not 20 years, maybe 10 years they've been around, maybe 12, I'm not sure. But they didn't have all the lesson plans and the materials that come with them that make it so easy to just kind of transition it into a classroom. So we developed that with actually grad students in NC State. So we kind of want to hire local at the same time, support the students here who are going to be future teachers. So these are STEM education majors. They helped us design this curriculum to meet NC standards. So really keeping it kind of in-house per se. And so with having all of that behind us, I think it made a powerful pitch as to the impact we can make, because we were already very intentional about it.
Part of our mission is expanding access to healthcare in an under-resourced area, and how fitting it is that through our Kids for the Classroom program, we're also expanding access to STEM education to underserved areas as well. So it's that's at the core of our mission, is really providing resources and access to individuals that might not otherwise have those resources available to them. So that's kind of what is inspiring to me about sort of all of our programming and sort of the mission behind it.
That empowering.
Yeah, exactly. Yeah, that's our mission statement, is to empower the biomedical engineering community to increase access to healthcare around the world. We have a lot of programming spread across a very small team. So
definitely very thankful for our team. We have one member in Uganda, one member in London, one member in Winston-Salem, and then Durham and Illinois. So, we're all over. So definitely small but mighty. But we also have a lot of contractors, meaning grad students that we hire and previous alumni that we hire just to help us with the program. We're also very thankful to them and their support, and of course all our donors, including STEM RTP.